Good afternoon, everyone, and welcome to this regularly scheduled meeting of the Public Health, Environment, Civil Rights, and Engagement Committee. My name is Philippe Cunningham, and I am the City Council member representing the 4th Ward in North Minneapolis, as well as get to serve as the chair of this esteemed committee. With me at the dais are my colleagues, Councilmember Cano, Schrader, Vice Chair Gordon, as well as Councilmember Johnson and Council Vice President Jenkins. Please let the record reflect that we have a quorum and can conduct the business of this committee. Before getting started, I also want to make sure to give a shout out and big thank you to our committee coordinator, Kelly Giesler, as well as say thank you to our city attorney for this committee, Andrea Neff. On our agenda today, we have 5 items. 4 are for consent and 1 is for discussion. So we'll go ahead and dive into the consent agenda. First, we have approving the mayoral appointees for 2 years of John Turnipseed and Dr. Rachel Harden, as well as a 1-year term for MPS Director Kimberly Cabrini, as well as within that item, waiving the residency requirements for Mr. Turnipseed and Dr. Hardman. The second item is accepting a grant from the Pew Charitable Trust in the amount of $50,000 to implement resilience model replication at Minneapolis public housing sites through MOU-based emergency preparedness, resident engagement strategies, healthy home visits, solar installations, and energy audits for eligible properties owned and maintained by Little Earth of United Tribes. Item number 3 is a grant from the Minnesota Department of Health in the amount of $15,000 to conduct blood lead testing events in neighborhoods that have low rates of lead screening. And number 5 is setting a public hearing for May 6, 2019 to consider the Neighborhoods 2020 framework recommendations. Do any of my colleagues have any questions on these items? Council Vice President Jenkins.
Thank you, Chair Cunningham. I'm just curious, have the 2020 framework recommendations been presented yet?
No, they will be presented on May 6th as well. But they are online currently. The current recommendations are online on the Neighborhoods 2020 website.
Okay. That's what I was thinking of. Thank you very much.
No problem. Seeing no other comments or questions, I move approval of these 4 items. All those in favor, please signify by saying aye. Aye. Those opposed say nay. The ayes have it, and those items carry. So our 1 discussion item for today is receiving and filing a presentation on recommendations from the Mayor's Multi-Jurisdictional Task Force and the Health Department's efforts to address the opioid addiction issue. So I do believe, who's going to be kicking us off here? Noya, please, the floor is yours. Please come on up and introduce yourself. Thank you so much.
Thank you, Chair Cunningham, and thank you, council members. I'm going to take us through a PowerPoint slide here that just has some summary information about the task force and the recommendations. Then I'll be talking a little bit about the work that the health department has been doing and will be doing. Introduce yourself. Thank you. Noya Woodridge, Deputy Commissioner of the Minneapolis Health Department. Thank you. So I just wanted to take 2 slides to talk a little bit about the numbers for the epidemic here in Minneapolis. On this first slide, the larger of the charts that you see talks about the disproportionate impact of opioid on different communities here in Minneapolis. These numbers are for 2011 to 2018. The blue bar that you see is the rate of overdose deaths, and the green bar that you see is actually the percentage of population in Minneapolis for that particular community. So you can see for the white community that the population of Minneapolis that is white is 59.9%, and the percentage of overdose deaths is 56.1%. Where you see the real disparities show up is if you look at the left-hand side of the chart, the American Indian communities. those that identify solely as American Indian, or those that identify as American Indian in combination with some other race. And then in the African American and Hispanic communities are two other areas where we see some significant inequities in how the opioid issue impacts them, particularly as it relates to death from overdose. This next one is the crude mortality rate. So there's you have to look at these numbers. When I first looked at the numbers, I was like, wow, 709 deaths in the American Indian community. That's 709 deaths per 100,000 American Indian people. We know that there's not 100,000 American Indian people in Minneapolis or even Minnesota, so you have to take that into consideration. But again, you'll still see that American Indian and African American experience some of the higher rates of mortality due to opioid use. Next, a little bit about the task force itself, just a summary. It was formed in April of 2018, had its initial meeting then. That was prior to my starting with the health department. During the summer months, the subcommittees that were formed at that initial meeting met to come up with recommendations. Those subcommittees are prevention, treatment, recovery, and peer support, community systems integration, and child protection and criminal justice reform. Those subcommittees came back together as a large group in February of this year, and they came forward with 18 recommendations and 51 action steps. You should have a copy of the full set of recommendations that was provided to you earlier. A little bit summary of the recommendations. There is some crossover between recommendations coming from each of those 4 subcommittees, but I just tried to pull together some of the highlights. So there are a fair number of recommendations in the area of education, both educating the general community about the opioid epidemic, about who it's impacting and how it's impacting them, and what we as an average citizen can do to help keep our neighbors safe from this epidemic. There's a focus on educating youth in particular, both those youth that might be at risk for opioid use at some time, or for those youth that have people in their lives that are active opioid users. The one very clear recommendation that came out of the task force was that any education that we do should be culturally specific to make sure that we are getting the right address to the right community. There was a couple recommendations having to do with law enforcement, mostly making sure that we are enforcing drug laws to the fullest extent and adding some officers to be able to do that. There's a fair number of policy issues that are in the recommendations. So some policies around testing strips and needle exchange limits. So there are testing strips out there to test fentanyl, the presence of fentanyl in opioids. And fentanyl is the chemical, I suppose, that's been added to heroin that makes the heroin high a better one for those that use heroin. But fentanyl is also the thing that is most likely causing the overdose and the mortalities because of the strength of it. And there are testing strips that people can use to test whether or not their drug has fentanyl in it. These testing strips, though, are considered drug paraphernalia, and if this person were to be picked up on a crime, that could be listed as paraphernalia and used as evidence in some way. Yet it's a tool that we would like people to have in order to help keep them safe. Same with needle exchange. So there are a lot of individuals and organizations that do needle exchange, but right now the law reads that you can, as an individual, you can have 10 needles on your person. If you have more than 10 needles, that's an illegal number of needles to have. So if you're doing a needle exchange program for one of the organizations in Minneapolis, North or South, you are often going to have more than 10 needles on you because you need to be handing out more than that, and you will definitely be collecting more than that. And so we need to look at the law as it pertains to needle limits. We're also looking at workforce development. There's just generally a lack of people that provide treatment, recovery, and peer support services to folks who are experiencing chemical issues. There is specifically a shortage of people of color that provide these services. And in our efforts to provide culturally specific services, that's really important. And then in the programming area, all 4 of the subcommittees recommended that we look at the Next Step program and replicate that for opioid. Next Step is the program that's located in Hennepin County Health and North Memorial, which is geared towards victims of gun violence. So there's a desire to take that and remodel it to work on the opioid issue. There's a desire and need for greater availability of medication for opioid use disorder, so that's a medically assisted treatment model. There's a desire to have safe places for people to dispose of their pharmaceuticals that they might have been prescribed and no longer need. And then harm reduction and jail to community services. So this is just a summary of some of the recommendations. So we've actually been busy at work at the health department already during all of this process, starting end of last summer. So using some money that was included in the budget for 2019, we've secured a consultant, Sherry Moldenhauer, to help with some of the program development and grant writing that we are doing in order to continue doing this opioid work. If you follow the link that's noted here, you'll get to the health department website, and Maria and Carl, who I'll introduce in a bit, have put together a whole bunch of resources that people can access on the website for treatment, harm reduction, and medication disposal, and anything else related to opioids. The Minneapolis Health Department has partnered with Minneapolis Police and the Minnesota Department of Health on the pilot of a opioid overdose mortality review process. Mortality review processes are used for any number of issues. They're really informative in helping us understand the systems and the circumstances around a person before their death, and after their death, so that we can make recommendations about how things could improve from a system perspective, a policy perspective. And so we have been working with them on this since last fall, and we're getting near the end of this pilot phase for that. Last fall, we worked with MORE-CORE, Minnesota Opioid Response Corps, and we secured 2 core members, Maria Clark right here and Carl Noyes. They've been with us since November, and really without them, I'd have 2 blank pages here. So I really thank them for all the work that they've done. And we've been approved to receive 2 more starting in November again of this year. And then we are looking at creating an advisory committee to help advise our work as we move forward. More that we're doing. We are connecting trainers of naloxone administration with those in need of training, including school staff and staff from community-based organizations. We are building a whole host of network relationships and collaborations. Conversations and meetings to discuss possible collaboration have already taken place with Metro Transit, the Minneapolis Park Board, Minneapolis Police, the Fire Department, 311 Emergency Medical Services, Hennepin Health Emergency Department, Next Step, and many of the community-based nonprofits providing prevention, treatment, recovery, and harm reduction services. So we are out there busy having meetings and building relationships that will help us do this work. And then we secured a technical assistance relationship with the New York Department of Health and Mental Hygiene through the National Association of City and County Health Organizations. Along with the technical assistance will come $200,000 to specifically work on developing a hospital-based opioid OD response program, replication of Next Step, developing a social and other media campaign to educate the public about recognizing signs of an overdose, responding to an overdose, disposing of needles, and getting support services, and then expanding the availability of medically assisted treatment in Minneapolis. As we move forward, As we look at the recommendations, as we being the health department, as we look at those recommendations, there's a few things that we're going to be considering when we apply some priority to those recommendations. One is, do we have funding available presently in order to do that work, or will we be able to more easily get funding to do that work? So there's some types of work that are just easier to fund, and those are the things that we'll try to focus on out of the recommendations. A few of the things that we are focusing on right now is replication of the Next Step program for opioid work, creating a system of navigators to connect those in need of services to the necessary services, social media and other campaign, expansion of treatment opportunities, increased opportunity or availability of harm reduction services, and school-based and community-based education. The funding picture right now, we do have the $200,000 that we'll be getting from NACCHO. We have pending applications into the Minnesota Department of Human Services with the Medica Foundation. We're currently working on a proposal to SAMHSA, and then we do have budget requests that are going forward for general fund in 2020. A few things that we wanted to put in front of you for consideration. So the advisory committee that we are forming is going to be made up of community members. Specifically, we will seek representation from the American Indian and the African American community, and we would like to have representation from people that have lived experience with opioids. So one question for you all to consider would be, are there others that you believe should specifically be represented on this advisory committee? In reviewing the recommendations from the task force, are there ones that you believe should be prioritized as you look at all of them? Is there more information that we could share with you about the opioid issue in general? And would you like to receive regular updates on the progress that we're making on the recommendations? And then in your wards, there are neighborhood associations and other groups that meet regularly. Are there specific ones that you would like to see us go to and do a presentation? For example, 2 weeks ago, I went to the Hawthorne Huddle in North Minneapolis and did a presentation with that group. So those are some things for your consideration as we're moving forward. And then just lastly, here are any of the people that you can contact. Heidi did want to make sure that I apologized on her behalf. She had another engagement at this time. She wanted to be part of the presentation, but wasn't able to get her other meeting moved. She's the primary one from the mayor's office that has been working on the task force and the recommendations. And then there's contact information for me, Maria Carl, and our consultant, Sherry.
Great, thank you so much, Noya.
Yes.
So I just want to let my colleagues know that at the dais, there is a letter that starts off with Dear Mayor Fry. And if you flip to beyond the letter, you will see the recommendations that are listed out so that folks have an opportunity to take a look at that and be able to answer some of the, can you go back to the last slide? Some of those questions that are in red. With that, I open up to my colleagues for any questions or comments. Council Member Gordon.
Thank you so much. I really appreciate the report and coming here today and bringing this forward to the committee. I think it's important that we get involved and get engaged in this work. This is such a serious problem, maybe unexpected, unplanned for, but obvious and clear need in our community. And I think it's important that we step up as a city and also with our other partners. So I'm appreciate us having the opportunity to take this on. In terms of a group to outreach, hopefully we're looping in our Public Health Advisory Committee so that they're aware of the situation. I think that they might have some input on priorities and those kinds of things as well. And maybe there'd even be some interest in having the advisory committee have a bridge back to that advisory committee so that they're connected somehow, and I'm not quite sure how to work that out. I'm also interested in how we can better connect this work to the council itself, and I don't know if there's a role for somebody in a council office to be on the advisory committee or really how you're envisioning that, but that's just a possible suggestion. One thing that I'd like to do here today is give a staff direction, kind of indicating that we're supportive of this work, that we want the department to move forward with this work. And I'm been trying to figure out exactly how to draft that. I think you're asking about priorities, and some of these things really stand out to me as having a lot of potential too. We could name some of them. I really like looking at how we could replicate the Next Step program, and when somebody shows up at a hospital, can we actually intervene and bring them some services there, and offer them things? I think that's critically important. I also think this idea of navigators for services shows a lot of promise. I think education and harm reduction services in general are also really important. And I'm very curious about this overdose mortality review program. I think it offers us some potential to look back at where we could have intervened earlier in somebody's trajectory towards that tragic moment to make a difference. And I'm also interested in having a report back to the committee on some regular kind of basis. So I sent around via email, and I'll read it out loud, make sure it's all in the public record and everything, a possible staff direction, but I'd also like to hear from others about what they think about that, and unless there's nobody else who wants to talk, then I can keep going.
I definitely want to talk.
Would you like to?
Oh, yeah.
Okay. Why don't I hear from some other folks, and then I'll see if I have a staff direction ready to move. Thanks.
Councilmember Kano.
Thank you, Councilmember Cunningham. Just a quick question. It might be a little early, but I'm curious if you can help us anticipate or foresee what some budgetary conversations might be relating to this work. I know this work has been happening for a while, and I'm speaking specifically about the task force, and just curious if we are going to maybe receive some requests either from your department or other departments in the enterprise about what it's going to take to provide a foundation for some of the recommendations that might come out of the work group or that have already come out.
Chair Cunningham, Councilmember Cano. So for the Next Step program specifically, the replication of that, because we're working on a proposal for that right now, I have a few more numbers in my head. But we believe that that will take about $350,000 to $400,000 to implement that program in Hennepin Health, or HCMC, as people more commonly know it. We do have one of the pending proposals that we have submitted, and the one that we are working on submitting, will help fund replication of Next Step. But between the two of them, we still won't quite make that $350,000 to $400,000. So there is a request going into general fund, starting the process for 2020 to help support that particular program. We do have my time committed to the project, but my time is thin and spread all over the place. And then we have Maria and Carl who are working on project. The one thing that we would like is a coordinator type person that works in the health department that really takes the lead and heads the charge on this work. A person like that, including benefits, would probably cost around $80,000 to $90,000. One of the pending proposals that we have in would allow us to hire that person. We tentatively plan to use some portion of that $200,000 that we are receiving from NACHO to get that person hired, with the assumption, fingers crossed, that some of this other funding will come in that would allow us to keep that person. So that's another cost. The other request that's going, starting down the pipeline of the budget process for 2020, is some money to do some of that youth education work. And then we're just continually looking for other funding sources that we can apply for, state, federal, private, you name it.
Thank you. I have a few questions. My first is, I know that we have in the presentation the rate per 100,000. Do you have absolute numbers as well that we could potentially get?
I could look to see if I can get that.
Yeah, that would be
yes.
really
Yep.
appreciated. I'm just curious as to what we would be seeing there. Also, so I'm curious about what kind of, if there's been conversations or if there's any work that's already happening around business supports. Because one of the things that I've had quite frequently is actually business owners, particularly on Broadway Avenue, West Broadway, to be able to get some additional support because they have people who are ODing in their bathrooms. And so I'm curious if that was something that's been discussed or if there's been any work on that particular area.
Chair Cunningham. So at the June staff meeting for the health department, we plan to have a little bit of an extended conversation about the opioid issue. The purpose of that conversation will be to look at all things that health does and all places and people that health engages with to see where else are we seeing impacts from the opioid issue. I suspect that through our environmental health programs, particularly the inspectors that get out there to businesses, that we'll hear stories like this. I'd not heard about it so much in North Minneapolis. We have heard about it in South Minneapolis with people in the park bathrooms, in business bathrooms, passed out from overdose. So we will certainly continue to look at all of those issues and try to find out more about the problem and what potential role we can play in helping with it.
Great, thank you. Yeah, that is something that I've heard, at least with West Broadway. So also I'm curious to hear more if there has been any thoughts kind of fleshed out more concretely around the jail to community supports, because I know that when folks are coming out of incarceration that they have astronomically higher chances of overdosing because they went in at a certain level of tolerance and then are coming out without that same level and then try to use at that level and then end up ODing. So has there been, because I saw that point that was brought up, has that been fleshed out anymore with like actual strategies or ways that the city could be of support for that?
Yes, Chair Cunningham. So we met with Julie Bausch from Hennepin County, who is the young woman that's heading up their opioid response work. And Hennepin County, for the jail downtown here and for the workhouse, both women and men's side of the workhouse, they have implemented a Suboxone program in those facilities. So if someone enters either the jail or the workhouse and is demonstrating signs of opioid addiction, they are offered the opportunity to get on Suboxone, which will help them wean off of the pills or the heroin, whichever their drug of choice is. Then there are supports within the workhouse and the jail that will help connect these people to ongoing treatment once they leave the facility and ongoing services. So through our conversation with Hennepin County and with Julie, we understand that that particular issue for the 2 Hennepin County facilities or the 3 Hennepin County facilities is mostly managed and taken care of. When we talked to her, though, we agreed that jointly Hennepin County and Minneapolis could approach the state system to see what the state is doing in their system. And we've heard that there is some work, some beginning work going on in the state system, but we need to figure that out, whether or not it's happening and how it's happening. And then the one other thing that we're going to do is to look at whom Hennepin County is referring to for services when people leave the facility to make sure that they have a nice broad array of options for people to take advantage of.
Great, thank you. And the last question I have is, so we've been hearing more and more about kids who are struggling with addiction as well. Wearing fentanyl patches while at school, for example, right? And so will there be, or is there space for specifically youth representation is one piece of it. And then the second is, have we thought about utilizing the youth street outreach team that, we have kids, folks who are going to be over in Cedar Riverside. We have some who are Patrick Henry, some who are downtown. Have we thought about leveraging those folks who already have a lot of connections with kids to be able to get them connected to resources in this way?
Chair Cunningham, that's an excellent idea. We had not thought of that. We were really geared towards the school and the community-based organization in our education efforts, but it is a good reminder about the outreach work that's being done, and that would be a good avenue for us to take some of this information and make sure it's getting out. Thank you.
Thank you. Do any of my colleagues have any additional questions or comments? All right. Councilmember Gordon, do you want me to hand it back over to you for your staff direction?
Yes, please. Thank you very much. This is what I have so far, and I welcome any input. So this would be to direct the Commissioner of Health to further evaluate the opioid task force recommendations, explore further options, and determine priorities based on potential positive results and feasibility. The recommendations evaluated shall include replicating the Next Step program for opioid work, creating a system of navigators to connect those in need of services to services, increased education and harm reduction services, and the development of an overdose mortality review program. I'd like to further direct the Commissioner to report back to the committee on a quarterly basis, is all I said.
Have you sent that over to Kelly?
No, I have to fix a few typos that I just noticed when I was reading it, and then I'll send it to Kelly.
All right. Thank you so much. So we have a staff direction before us. Would you like to make a motion for that?
Yes.
So moved. All right. So with that motion, do any of my colleagues have any comments or questions on the staff direction? Anyone? Anyone? All right. So he'll be sending that over shortly. And with that motion, with that staff direction and that motion, I move approval. All those in favor, please signify by saying aye. Aye. Those opposed say nay. The ayes have it, and that item is passed. Thank you so much, everyone, for all of your work on this. It's a huge task, and on top of all of the other work that you are doing in the health department, one of the things I love about being the chair of this committee is that I get to look into all of the work that's happening in the health department. So to add this on top of it, I just think it's necessary for us to name that this is an additional line of business that's going into the health department. And you all stepped up with no hesitation, stepped into it, made the request so that we got a little bit of money in this past budget for this year and looking forward to next year. So thank you all so much for your leadership in this area, for stepping up, and for doing some really amazing work. Okay. So, and for the viewers at home, I just want to take a moment to remind everyone to check out lims.minneapolis, spelled out, mn.gov, to be able to learn about more of what we're doing here as City Council, and to be able to make sure that you know and let us know what you think. Reach out to your council members. With that, with no further business in front of this committee, we are adjourned.